some proposals in front of the legislature that would cause or implement, rather dramatic cuts to the reimbursement and dispensing fees that community pharmacies receive. And in addition, the state is contemplating moving to a managed care format with very restricted networks. Perhaps you can speak to, the impacts that will have on employment, the community pharmacies, their stability in the community, and also on the relationship between pharmacists and their patients.
Most states are going through very tough times, and Texas is one of those that is having much difficulty in meeting the needs of the services and programs and basic infrastructure for the people who live here. In fact, we're short billions of dollars. And so because of this deficit, because of budget shortfalls, our state, and I know other states, are looking at measures that would cut their Medicaid expenditures, at least cut them on paper. And any cost-saving mechanism is on the table. But there are false assumptions and kind of false choices here. When it comes to pharmaceutical products, and particularly when it comes to prescriptions and our own Texas Vendor Drug Program, we know that the most cost-effective way to have a Medicaid system that doesn't blow out in one other sector is to have great access to prescriptions for the people who use the program. In doing so, we make sure that folks who have gone to the doctor, who are on their medications, particularly in Texas for chronic diseases, that they stay on their medications. The special relationships that community pharmacies have with their patients ensures that compliance. And in fact, our data indicates that patients see their pharmacists 6 times more than they see their physicians. And that's a good relationship. But if we take a system that has access for Texans who use Medicaid and use services, and then we take it into a managed care situation where there is selective contracting, where there is things like mandatory mail order, those things might work for an employee type health program, but they will not work for our Medicaid population. And what happens is, sure, they'll reduce the cost on paper of the prescriptions, but when you can't get access because pharmacies are closing, particularly in rural and inner city areas, that we know people on Medicaid live in pockets. Those pharmacies cannot withstand the type of cuts that would come with a totally managed care prescription plan, and they'll close their doors. So what happens when people can't get their medications? Sure, the pharmacy budget looks really good because you've squashed it down, but what happens when you need to go to the doctor and more diagnostic? And what's the highest cost driver? More hospitalizations. It makes common sense for us to keep the vendor drug program within the state, operated by the state, and then institute cost-saving measures like increasing generic utilization, making sure that we get the benefit of those cost reductions, not some for-profit big insurance company or big managed care company. Why would we want to send those profits out of state when right now the availability of access makes sure that, number one, patients get their medications, they have much better compliance, and the economic side of that is that it's put right back in to the Texas economy. I don't know about you, but it seems to me a very false choice when we try to ratchet down pharmacy reimbursement rates because it's under managed care, when all of a sudden it just becomes big corporate profit. And then the mom and pop pharmacies, the people who have been taking care of Texans for generations, have to close their doors. It's a false choice and a false argument. We need to make sure that the Texas Vendor Drug Program remains as it is and institute those cost savings that'll make it even more effective.